Good afternoon. My name is Angela, and I'm in a group with Casey and Caitlin. And this semester, our group project was community assessment on Tylertown, Mississippi, or Waltz Hall County. We used windshield surveys, vital statistics, and key informant interviews to gather our data for our assessment. Our theatrical framework that we used was community as partner, which allows us to um, coordinate with the community and do a community assessment, identify strengths and needs, develop collaborative goals, design and implement interventions, and evaluate and refine interventions. The history of Tylertown, Mississippi and Walthall County. It was created in 1910. Local government was established in 1914. In early establishment, it was an agricultural area. Most of its money came from cotton and dairy. It was named after General Edward Carey Walthall, who served as a U.S. Senator from 1885 to 1894. Ruby Bridges was born in Tylertown, and she was the first African American child to integrate into White Public Southern School in 1954. Tylertown is rural southern country town with within hospitality state. Overall, the residents enjoy the small town feel of this area. Population is 13,863. Under 18 years old is 22.6% of the population, and 65 and older is 21%. Female is 51.3%, so pretty half and half there. 53.4% of the community members are white, and 41.8% are black, and we have 0.7% Asian population, and Hispanic is 2.1%. There are several churches within the area. It's got a very southern hospitality charm. Our informant interview stated it was mostly farmers and Baptists, and we found that to be true because 40.8% of the population are good at attending church regularly, and they are Baptist. It's a small and quiet town. There are some historical businesses and some new ones. Problems include nutrition and obesity, and that is from lack of options, and that is according to the school nurse. They do have some severe housing problems, which include one of the following: overcrowding, high housing costs, lack of kitchen facilities, or no plumbing. They also have a long commute. There aren't a lot of jobs in the area that pay well, so 48% of people have to commute over 30 minutes to get to work. But 79% of people do own their own home, which is higher than the state and national average. They have one hospital in Tylertown. There are some family medical clinics and some mental health clinics in Tylertown. Health department and Department of Health and Human Services are next to the health department. There is also a food pantry for low-income families. One drawback is a lack of specialty care. According to a medical doctor in the area, we do not even have a general surgeon in town. Common problems within a rural community is a lack of available resources. There are 1,980 people per one clinic or primary care doctor. Mental health is even worse, and for some reason, they're very passionate about their dental hygiene. There is many dentists available in Tylertown, so that's good. 16% of community members are uninsured, and there's only 78% with broadband internet access. So that limits resources even more. Telehealth visits and whatnot can't happen if they don't have access to internet. There's about 16,700 years taken off their lives before the age of 75. That is a high amount of years lost that can be prevented. So they have a lot of premature death. Child mortality is 70%, no, 70 per 100,000 people. 179.9 death related to heart disease, which is the #1 cause of death, and that looks like it is a Mississippi issue and related to comorbidities that can be prevented. Diabetes is also high in Mississippi and in Tylertown, and high obesity rate. There's also frequent mental distress in this rural community as well. There are mom and pop shops and only one grocery store, the Piggly Wiggly, lots of fast food chains, and there are not very many jobs that pay well, as we've already stated. Unemployment rate 4.1, children in poverty 31%, that's higher than the state and the national average. Income inequality, there's a huge pay gap between the very wealthy and the poor. Gender pay gap is women make 52 cents for every dollar that a man makes. Segregation is 27. That is on a scale to 100 being completely integrated. So there's a lot of work to be done for integration still. There is also limited access to healthy food. 12% of people have a hard time getting to the healthy options. There are no public transportations. There is only, you have to have a car to get anywhere. There is a police and sheriff office, and you can see a lot of people riding bicycles in the summertime. Unfortunately, there is a high rate of death related to automobile accidents, 34%, and that is likely related to the rural, how it's so spread out. It probably takes a while to get to an accident site. 2020 election showed that 59.3% voted for Republican and 39.8% voted for Democratic. The mayor stated that he supports many advancements in Tylertown and will continue to do so. Tylertown has a radio station, newspaper, and social media involvement called What's Happening Tylertown. There is education. There's one private school called Union Academy. There's lots of daycares. No college or trade educational opportunities are in this area. 56% of people will go on to get some college. 80% will complete high school, and the reading and math scores are below average. School funding is inadequate at negative $12,242, and there are plenty of child care centers available, which is a positive thing. There are some recreational options. They have Fun World. Recreational center offers rooms for birthday gatherings, indoor trampoline jump section, arcade, and indoor skating, which is kind of cool. They also provided citizens with Holmes Water Park, and it offers a nice play area for kids and a walking trail, baseball field. Paradise Ranch RV Resort is a fun place to go camping. Unfortunately, the need is there. There is 33% of people who have physical inactivity, and obesity rate is high, as well as diabetes. The community issue here is poverty and limited resources. Many people in the community struggle to provide adequate food, utilities, safe housing, and healthcare. Studies show that 25% of working citizens generate income below the poverty line. Limited resources are available to combat this tragic issue. So the nursing diagnosis is increased risk for ineffective coping, specifically for low-income community members, related to the limited access to health services and limited resources, as evidenced by increased rates of preventable illness, poor housing conditions, and food insecurity. Public health interventions are, this is a framework that allows a visual representation of the essential services provided in public health and the core functions of the interventions. We're going to use these interventions to advocate, collaborate, and teach. We're going to develop culturally sensitive information and education, and that is a primary and tertiary prevention strategy. We're going to use handouts at a 5th grade reading level to focus on nutrition, chronic disease management, and tips to increase physical activity. We're going to collaborate with healthcare facilities to coordinate mobile screening, and that's a secondary prevention strategy. We're going to provide immunization, screenings, and education to help serve community members without transportation. Collaborate with local businesses to expand resources, tertiary and primary. Work with local employers to create better training and skills. Work with local churches, schools, and community members to expand available options. Our goals are that community members will demonstrate understanding of how to decrease the risk of complications by eating well at balanced meals and increasing exercise within 3 months, and community members will increase participation in health screenings within 3 months, and community members will verbalize understanding of available resources within the community within 3 months. We'll evaluate this by noticing increased attendance to educational classes, increased use of preventative health services, and increased engagement and increase in available resources. The public health nurse is the nurse for the job. She is a professional at nursing at a population level, and she is best suited for community assessment, community education, policy advocacy for the community, and collaborating within the community to make this happen. Thank you very much.